Yeah, my name is Hein. I'm a consultant psychiatrist, professor of psychiatry, and editor of Global Psychiatry Archives. And I'd like to report about a study of Cummings et al. From Australia about diminished white matter integrity 4 decades after traumatic brain injury in Vietnam War veterans. So this study is a co-study of a study of about the cognition of people who had traumatic brain injury 40 decades ago, and the study, which has been published in the same journal, showed that there is some cognitive impairment in those with moderate to severe brain injury. So this is an MRI study, and there have been 87 male veterans in total. There were some with traumatic brain injury, 35 with post-traumatic stress disorder, 21 controls, and they had a 3 Tesla magnetic resonance imaging. The TBI cohort, so traumatic brain injury cohort, had 12 with mild, 13 with moderate, and 6 with severe injury. Right, okay, the imaging was quite difficult, and they showed the fractional anisotropy, which is more or less a measurement of the structure of the white matter in the brain. There were other studies, MP-RAGE, to check hippocampal volumes and whole brain cortical thickness. Right, okay, so let's come to this study and just look at this sample. Or this is about the criteria used for the severity of the brain disorder, and it's a criteria by the Department of Defense, and it's usually because the medical records weren't available, so it's historical assessment from the patient's information, and the question is the duration of the loss of consciousness, the alteration of consciousness, the post-traumatic amnesia, how long it was, a Glasgow Coma Scale, and structural imaging, whether it was done or not even done or was abnormal. Right, okay, so there was psychiatric evaluation of the patients, and there was imaging. There were MP-RAGE flare sequences, and also other diffusion imaging, which the criteria and details you have to find on the paper in case you have interest to read it. It's to be found in www.globalpsychiatry.co.uk, and it's in volume 4 of the journal. So coming to the sample again, so these are patients, healthy controls, traumatic brain injury, PTSD patients. They're all quite comparable. The IQ was a bit lower with the people with PTSD and TBI. So that might have some influence, but the assessments of the imaging was adapted to that, or there was some covariance. Right. So people with severe brain injury or TBI and PTSD had more mental health problems, which have to be accounted for. And in total, what you can see is different distributions of the TBI severity. That's the blue is mild, moderate, and severe, and there are different causes: blast exposure, falls, motor vehicle accident, and sports related. Interestingly, sports seems to be quite dangerous, and these are the results from the imaging. So these are the comparison between healthy controls and people with moderate to severe TBI, and what you can see some different changes in the corpus callosum. So this is a white matter area, and it seems that there are some differences. Compared to the PTSD and the controls, there is no major big differences. So here you see the bar of the significance of the values. Right, and what you can see is again that the global fractional anisotropy was different between healthy controls and severe TBI. And in the genome of the corpus callosum, the same thing. Differences between people with severe TBI and controls, and so same in the in this splenium and other areas of the corpus callosum. The hippocampal volumes and other cortical thickness, there was no big difference, and so there wasn't any major difference between the groups, which could have something to do with the size of the group. There was some vague or whatever correlation between splenium, fractional anisotropy, and cortical or whatever attention and processing speed, as well as with learning and learning and memory scores. But I think I wouldn't overestimate these correlations, because they're quite, when you look at the pictures, it seems to be that outsiders had a major implication on the correlations. Anyway, so what you can find out that, more or less the hippocampal volumes, not a problem. The cortical thickness, no major difference. And the corpus callosum has, let's say, the white matter was most affected. And this has some implications, because the areas which are most affected by Alzheimer's disease are more or less the cortical thickness, and so destruction of white matters, and especially reduction of hippocampal volume. So it might be that people who have severe brain damage might be diagnosed more often with dementia, simply because they have severe affection of the corpus callosum, which affect the cognition, instead of having the typical brain damage, which Alzheimer's patients have. They might be treated differently, but that needs to be looked at in the future, as well as the inclusion of females needs to be done to see whether there's some importance or differences with males and females. So if you want to read this paper, look at www.globalpsychiatry.co.uk, volume 4. And if you want to hear or see other videos of short summaries of papers, then subscribe to our channel. And as I said, the twin paper or the co-paper has been published and been reported recently. Thanks for your interest, and thank you so much. Bye-bye.